Philadelphia's street drug crisis is entering a new and more dangerous phase as medetomidine, a powerful veterinary sedative, replaces xylazine in fentanyl supplies, creating a nightmarish situation for drug users and healthcare providers alike. This shift marks a disturbing escalation in the complexity of the opioid epidemic, with new chemicals making an already lethal crisis even harder to combat. Medetomidine, which is 10 to 20 times stronger than xylazine, is rendering standard overdose treatments ineffective, leaving victims in prolonged states of deep sedation, unresponsive to traditional interventions. This alarming trend raises serious concerns about the increasing unpredictability of the illicit drug supply and the lack of adequate medical strategies to deal with its evolving threats. The rapid emergence of medetomidine is yet another reminder that the drug supply is not just poisoned, it is being weaponized. The Philadelphia Medical Examiner's Office first detected medetomidine in fatal overdoses less than a year ago, and it has already overtaken xylazine as the dominant non-opioid additive in fentanyl. Unlike xylazine, which has been widely reported for causing horrific flesh wounds and amputations, medetomidine's primary danger lies in its extreme sedative effects, which can leave users in a catatonic state, unable to breathe properly, and unable to be revived with naloxone. The consequences are dire. Even when an overdose victim is given naloxone, it only partially restores breathing but does nothing to reverse the sedation, leaving them in a semi-conscious or comatose state. The result is more prolonged medical emergencies, greater risks of brain damage due to oxygen deprivation, and a higher likelihood of death. Adding to the crisis, medetomidine withdrawal is proving to be far worse than anything previously seen with fentanyl or xylazine. Patients experiencing withdrawal from this new sedative are presenting with extreme symptoms, including severe spikes in blood pressure, dangerous heart rate fluctuations, violent vomiting, and extreme disorientation. In many cases, standard withdrawal treatments such as methadone or buprenorphine are failing, leaving patients in a state of unbearable distress and forcing hospitals to scramble for new treatment protocols. Medical professionals are reporting that the number of patients suffering from severe withdrawal is unprecedented, and existing clinical approaches are no longer adequate. This means that even those who want to escape addiction face an agonizing detox process with little medical relief, pushing many back into the cycle of drug use simply to avoid the unbearable symptoms. Philadelphia's response to this crisis has been sluggish at best. While some hospitals have begun testing for medetomidine in overdose cases, the reality is that most emergency departments are still operating under outdated protocols designed for fentanyl and xylazine. Rapid drug testing methods, like fentanyl and xylazine test strips, are unreliable and ineffective in detecting this new adulterant, meaning users and harm reduction groups have no way to identify whether their supply contains medetomidine until it's too late. More advanced testing methods, such as chromatography and mass spectrometry, remain expensive and inaccessible to most hospitals and clinics, further delaying an effective response. The deeper issue, however, is that this crisis is not an accident. It is the direct result of an ever-evolving black market designed to outpace regulation and medical intervention. Just as law enforcement and healthcare providers began to understand and respond to the dangers of xylazine, traffickers moved on to an even more potent and unpredictable chemical. This cycle of replacement and escalation ensures that street drugs will only continue to become more lethal, more addictive, and more resistant to medical treatment. Worse yet, recent reports indicate that even more bizarre and dangerous substances, like industrial solvents, are creeping into fentanyl supplies, signaling that the chemical warfare on America's streets is far from over. The implications of this evolving crisis are catastrophic. With each new chemical introduced into the drug supply, the ability to treat overdoses and withdrawals becomes more difficult, leaving first responders and hospitals powerless to stop the rising death toll. Harm reduction efforts are also becoming increasingly obsolete as test strips and safe use strategies fail to keep pace with these unpredictable drug combinations. Meanwhile, those struggling with addiction are being pushed deeper into an unbreakable cycle of dependence, suffering withdrawals so intense that treatment options are ineffective or outright unavailable. Unless the federal and local governments act immediately to address this crisis with stronger drug monitoring systems, faster regulatory responses, and a more aggressive crackdown on the sources of these deadly additives, the situation will continue to deteriorate. This is not just another phase of the opioid epidemic. It is an entirely new and more insidious wave of chemical warfare against the most vulnerable populations. If history is any indication, medetomidine will not be the last drug to wreak havoc on the streets. Without urgent intervention, the next wave of synthetic sedatives could make even today's crisis look tame by comparison.